Hi, this is Aiden Daniels with Phallic 409. Today we're sitting down and talking to Dr. Elizabeth Pemberton, and we're going to be discussing her stance on stress in younger students and the overuse of ADHD medication and anti-anxiety medication.
In the schools, there is so much pressure now from everyone to do well on these standardized tests, and that comes so early on with pressures from the parents to exceed and excel and do well on these tests that the kids are, they're just trying so hard to do well, but not necessarily to enjoy learning. And I think that's influencing kids at a very young age. So you see more kids with full blown anxiety disorders, panic disorders. So I think for some kids, it is necessary. I think some kids are benefited from taking something like Adderall. Medications can help kids who are really having a hard time focusing. Um, but I think it is overprescribed. I think the problem of ADHD in both kids and adults is overdiagnosed. And I think it does kind of relate to there's going to be struggles in life, and how do we cope with those struggles? And there are going to be different kinds of kids in life, and how do we just accept kids, some who are quirkier than others, some who are more active than others. So I can see both sides. I think for some kids it's a necessary thing to do. I would, I think a lot of those kids go off those drugs in the summer just because it can affect growth, etc. Um, and I wouldn't, be I wouldn't be a fan of someone quickly jumping to the diagnosis or to medicating kids who have that diagnosis. The anti-anxieties, some of them are highly addictive. I don't think kids should be starting in on those. I think a lot of kids are anxious, but there probably are other ways to deal with that anxiety. Again, there are some kids with genuine anxiety disorders, like a panic disorder that's maybe more biological, where they would benefit from a short-term medication with therapy to get them over the hump and so that they can function well. And I've seen that happen. But the risk would be with the highly addictive kinds of drugs, keeping them on the drugs too often and not pairing it up with therapy to help them develop their own coping mechanisms to deal with stress.